Okay, good morning, everyone. Welcome to the Board of Supervisors meeting. Today is Tuesday, December the 8th, 2020. The Board of Supervisors of the County of Del Norte and the governing body of all other special assessment and taxing districts for which said board so acts is now meeting in regular session. Only those items that indicate a specific time will be heard at the assigned time. All other items may be taken out of sequence to accommodate the public and staff availability. Kylie, would you please take roll?
Supervisor Howard?
Present.
Supervisor Cowan?
Here.
Supervisor Gitlin?
Here.
Supervisor Berkowitz?
Here.
Chair Hemmingson?
I am here. And we will now take a moment of reflection. And now if you'll all stand and join us in the Pledge of Allegiance, Supervisor Cowan, Vice Chair Cowan, would you please lead us?
Thank you. Ready? Begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, introduction of new employees. Jay, do we have any?
We have none today.
Okay, County Council, any actions to report from closed session?
No, nothing to report today.
Thank you. At this time, I would request any deletions, corrections, or additions from board members to the agenda. In order to add an item to the agenda, the matter must have come to the attention to the county subsequent to the posting of the agenda, and the matter requires action before the next regular meeting of the Board of Supervisors. Is there any such items? Are there any such items? Seeing none, we're going to move on to the consent agenda.
Mr. Chairman, point of order. I'd like to pull item number 17 for discussion.
Okay,
And Mr. Chairman, I'd also like to pull items 5, 6, 7, and 10.
okay. And with that, did I get a motion then for the consent agenda? Minus those items?
Second.
Okay, I have a motion for the consent agenda minus items 5, 6, 7, 10, and 17. Is there any public comment, Kylie, on the consent agenda items?
I don't have any written, Chair, and I'm not seeing any hands raised online, so we do not.
Okay, then would you please poll the vote?
Supervisor Berkowitz?
Yes.
Supervisor Gitlin?
Yes.
Supervisor Cowan?
Yes.
Supervisor Howard?
Yes.
Chair Hemmingson?
Yes. Okay, let's take item number 17. Chris, you want to speak to that? The accept the reappointment of Don McCovey to the local behavioral health board?
Yeah, I received a request late yesterday from a member of the local behavioral health board concerning this reappointment. And he requested, and this is Clark Moore, requested that we delay the appointment until the board can have further discussion with the Director of Health and Human Services.
Okay, so-
And I'll speak a little bit further on that. I am on that board, and it was just supposed to be pulled. It will be coming back just at a later date. They just need a clarification at the meeting yesterday
All right.
that we received
You want
yesterday.
that pulled completely off the agenda, and we'll bring it back at a subsequent. Okay.
Thank you.
All right. So we're we're not even gonna have a discussion about that. We'll just pull that off the agenda and hold that for the next meeting. Roger, you had item 5, 6, 7, and 10.
Yeah, I'll be brief with this. Kylie, you can register my no vote on this. I think this is an effort that we need to spread the responsibilities and the continued positions that we've taken year after year after year of 2 or 3 different people doing these jobs is unacceptable to me. So I register my no vote on numbers 5, 6, and 7. Number 10, if we can move forward to that, I have some questions for Dr. Raywald if he is available on that. And that would be a question that I wanted to ask him before we vote on number 10. So 5, 6, and 7, no vote, and 10, I await Dr. Raywald.
You can
Sure.
register vote when we ask for the vote, but I don't even have a motion for it yet. Go ahead, Kylie.
Are we gonna take number 5, 6, and 7 as one motion, or are we doing them all separately?
I think we'll probably have to do them individually, or I guess we can do them all at once if I can get a motion for that.
I'd make the motion to approve items 5, 6, and 7.
And I will second that.
Okay, I have a motion and a second, and just for the public's edification, the number 5 is to approve and appoint Supervisor Hemmingson as the delegate as proposed, and Supervisor Howard as the alternate as proposed to the Golden State Finance Authority Board of Directors for the years 2021. And number 6 is approve and appoint Supervisor Hemmingson as the delegate as proposed, and Supervisor Howard as the alternate as proposed to the Rural Representatives of California Board of Directors for the year 2021. And just also for your information, those go hand in hand. The Golden State Finance Authority is part of RCRC, as well as item number 7, which is the Environmental Services Joint Powers Authority, which is to appoint myself as delegate and the Director of Solid Waste Management Authority, Ted Ward, as the alternate. So those are the 3 items. Have a motion and a second. Is there any public comment on those, Kylie?
I am not seeing any, Chair.
Any further discussion? Kylie, would you poll the vote, please?
Supervisor Gitlin?
No.
Supervisor Berkowitz?
Yes.
Supervisor Cowan?
Yes.
Supervisor Howard?
Yes.
Chair Hemmingson?
Yes. Okay, and then item number 10, Roger, you had some questions?
I do. Dr. Raywald, are you online? This is a recommendation to approve the memorandum of agreement between the City of Crescent City and the County of Del Norte for wastewater surveillance of SARS-CoV virus. Approve the county administrative officer to sign the agreement upon choosing the consultant. So Dr. Raywald, I wanted to know if you can please address what useful information, because I think we discussed this previous to this meeting, is going to be gleaned from this report. Has something changed since the last time you reported on the useful information forthcoming from this agreement?
Well, at the moment, it's not critical in any sense. It was useful for us over the summer to kind of monitor trends up and down when we had pretty low activity of disease in the community. Our experience and the experience of other places that have been doing this is that it gives you about a week's lead time to kind of predict what's going to happen. Right now, with the volume of cases we have, I don't think there's much utility to it. It's not something I'm going to be consulting to make decisions. I mean, it's kind of interesting information, but it's not, like I said, it's not mission critical at this time. Probably be more useful actually later on next year when things hopefully start to die down and we can start predicting downward trends for the first time, which would be a nice thing to be able to do. But honestly, right now, I don't think the utility is really that helpful, and it's not really critical to our efforts. We've gotten by without the information for the last month or more. So, I would keep that in mind. It's not something that we would have to have. It was useful to have earlier in the year, especially over the summer. But right now, it's not going to be that important to us.
So can you just address the cost? I know it's not a county cost directly to our general fund, but can you just address the cost of what this agreement would entail and for the surveillance and any other costs associated with this item?
Well, I'm not really involved in the payment part of it. My understanding is the cost is about $500 or so per report. And you can generate the report pretty much as often as you need to. We were hoping for a weekly report. So it would be about $2,000 per month to continue it. Like I said, right now, with the volume of cases we have, changes in this report on a weekly basis is not really going to change our mission very much. So, I mean, if we wanted to consider not doing this contract, I think we would be fine with it, at least for the foreseeable future, the next 3 months at least. Probably should be reconsidered at a later date. Like I said, as we start to expect to see downward trends, it'd be useful to be able to monitor that activity through this tool. And it's widely used. It's not like we're the only ones out here doing this. It's used around the country. But right now, when there's so many cases, and we know the disease activity is quite high, its utility is not as good as it was before.
I appreciate your forthrightness, and I just wanted to see if there was any difference from the last time you addressed our board, or some months back, I should say, to the validity of the data gleaned from this report. So thank you for your clarification on that. I appreciate it.
You're very welcome.
Jay, as I read through this, the costs and everything are all in this MOU. I don't know why those had to be re-asked, but this is a not to exceed $21,120, and it's tests that are agreed to by the city and the county. So we would only do these tests if we needed. So this is something that's in place so that if we need it, we can use it. Am I misunderstanding something, or is this being brought up for absolutely no reason at all?
So to address the fiscal part of it, the not to exceed, yes, it's a FEP grant. We have been using that grant up to a point of about $7,000 to this point. Once it exceeds 10,000, it requires a contract, thus the contract before the board. But based on Dr. Raywald's suggestion, I would say I'd recommend you table this until after the first of the year when it's more applicable. We can bring it back at that time. If you approved it now, we could go forward with it and do the testing. But I think based on the suggestion of the doctor, I would suggest you table it and we'll bring it back in a month or two.
Okay, we'll bring it back. Consider it tabled. Okay, so Doctor, so we're done with the consent agenda, and we're going to move on to our 10:10 timed item, which is an update by Dr. Raywald. Dr. Raywald, please enlighten us.
Yeah, I think a lot of what's happened is reflective of what's going on around the state and the nation. In our community, locally, we've been pretty hard with new case numbers. I estimate that we're at about a 5-fold increase in the volume of cases that we typically were seeing, a couple months ago. So it's the marker of the fall surge that everyone's been worried about and talking about all summer. I think it's finally here, really without that. It is starting to impact us a little bit. It's impacted our department in a very big way. Our nursing staff has had to work extraordinarily hard. It's been a very full time to try and compensate and stay on top of these things. I think going forward, our effectiveness at case investigation is going to be hampered by a couple of factors. Times are going to be increasing a little bit before they get better, if they do get better. And that makes it harder to do good case investigation in a timely way. So the effectiveness of what we've been doing and been able to do most of the pandemic is diminished right now. And that's not a good thing. It's kind of awkward timing because we know the need for case investigation, good tracing, and getting people into quarantine is greater than ever. But it is the reality. It's not. It's up and down the state. It's become automatic as the demand goes up. Testing starts to stretch out a little bit when you get results, and when you get results days after you've been tested, it's harder to make sense of that. Fortunately, a lot of people, when we've reached out to them, they've already taken some steps to go into self-isolation. So people are kind of getting the message. I think more than kind of. I think a lot of people have taken it to heart that while they're their test, or if they know they've been in contact, they need to quarantine. They need to do proper things, because that's the way it stays slower and slows down, or maybe stops again. I don't think we're going to see that for a while. We know that case volumes around the state are pretty high. Worse places in the rest of the country, there are quite a few places that are much worse situation than we are. Also started to impact our medical system. So this morning, there are 3 cases in our hospital. That hasn't happened before. So we're kind of starting to see this virus the way other people have been seeing it for a while. So I think the expectation is that we need to continue to do what we're doing as best we can. The big project for us is the vaccination program that's about to be released, or we think it's about to be released. For us, that's going to be a fairly small number of doses, but enough probably to get our frontline healthcare workforce at the hospital vaccinated, and perhaps at the skilled nursing facility, at least a good portion of them. Area that I really want to be able to focus on, because I think it's critical, is the medical staff out at Pelican Bay, because we do not want to have all those people getting sick while they're trying to manage an outbreak at that facility. But you know, the basic ground rules for this first rollout, this small amount of vaccine that's going to be available, have been laid out by American Council on Immunization Practices, and there's a state body that has reflected that, and they're pretty much identical. So it's frontline healthcare workers and seniors living in congregate facilities, and that's the focus right now. So our job is to, we've been doing it actually, contacting those entities and start producing lists of people that they should be vaccinated and are willing to be vaccinated, because not everybody's willing to get a vaccine. We've had moderate success at getting people interested. It's a 2-dose vaccine schedule. Pfizer vaccine, as you probably have all heard, is really problematic because of the ultra cold temperature requirement, which we do not have in our county yet. We're hopeful we can get that particular storage unit perhaps by the new year, but we don't have anything in the pipeline for this first rollout. So we are actually solving the logistical problem of trying to get vaccine from a local county and brought up to us as we need to. So that's our strategy, and that's what it's going to be for this first rollout. I think, you know, the vaccine for the general public is months away, and by that time, it should be fairly widespread and available through many venues. Right now, this is strictly a health department, health jurisdiction kind of allocation, focusing on, you know, the critical need for vaccinating healthcare workers. The only other thing I was going to mention is we still are working on our local testing strategy. It's getting closer. I know I've been haven't explained that we've had some setbacks. We are still solving some of those setbacks. Really anything we could predict or do anything about. So we're just rolling with circumstances as best we can. We sent a test run of some samples to the lab yesterday. So we're going to see how that turns out. These are legitimate samples of legitimate clients. And so we're almost to the point where we think we can start to roll that out. I do not think it's going to solve all our testing issues. I do not see any of the other testing avenues go away. You know, even if testing turnaround time is stretching out a bit, it's better to have testing available than to not have it at all. So we want to keep our Verily site. We want to keep promoting the idea of people using the CVS service, which has really been quite helpful at times. People need to still get tested when they think they have symptoms, and don't hesitate to find a place to go. I'll be happy to answer questions.
Anybody have any questions for Dr. Rehwald?
Yes, Dr. Rehwald, can you?
Bob, go ahead. Bob, you raised your hand. Go ahead.
Thank you. Dr. Rehwald, you know, is there any big difference between our virus is in Delaware County versus Curry County. And the reason I ask that is a number of people I've talked to are going to Curry County because, of course, no sales tax, but also they can go and dine in restaurants with no social distancing, and they don't seem like they're having a problem. What's the difference between Delaware County, where we're on lockdown, versus Curry County seems to be open?
Well, if I understand the state law from Oregon, they're not really open to that degree. Now, I haven't really looked at it in detail recently, but my understanding is that they have already taken some steps to limit those kinds of services. To answer your initial part of your question, I don't think there's any difference. We know there's a lot of traffic across the border. We see that all the time because our nurses have to work with Curry County staff as well, because we have shared cases. We have people who live on one side of the border, test over here, or they have employment on that side of the border, but they live here. It's happening all the time. So we're kind of tuned into what's going on up there. And their counts have risen quite a bit as well. I think they're part of the same process that we're going through right now.
Okay.
And I do want to, before I forget, I do want to make a real public plug for our nursing staff because they've been working so hard. And actually, we're going to be losing one of them, which is unfortunate, and that's really going to put extra pressure on our remaining staff. And it's just the worst timing ever. But they've been doing amazing work, and they really are the kind of the guard post for the community at the moment, because the work that they do helps keep this virus in check as long as we possibly can. And that is key, and that is absolutely critical to the whole effort that the county is doing to tackle this problem.
Roger, did you have something?
Yeah, I do. Dr. Raywald, I don't know if you're aware, but item 26 on our budget transfer, we're going to reconvene the Board of Supervisors, I should say, is seeking a $5,300 within the public health budget to purchase the required ultra cold freezer for the COVID-19 vaccines as requested by our Department of Health and Human Services. I wanted to make sure you were aware of that. I think that will happen this morning, and hopefully it will pass accordingly. But my question has to do with the spike, both at Pelican Bay and in the community, of the virus. Yet the impact of the virus seems to be less lethal. No new hospitalizations, certainly no new deaths. People are contracting the disease, but then recovering from it in what appears to be a shorter quarantine period than in the 10 days. Some people are recovering from it almost immediately. So my question is how this impacts our local business community here in Delaware County, especially restaurants, when, as Supervisor Berkowitz mentioned, you can simply drive up and go out to dinner and have an enjoyable evening in Brookings, 25 miles away. In your discussions with the state public health department, is there any understanding that they would relax certain counties, like a border county like ours, and allow businesses to, particularly restaurants, to open up? Because many of them, as we speak, are suffering on the vine. Maybe they won't even recover. And I see the word is lethalness of this COVID virus being less impactful as we move forward than what it was in previous months. Could you respond to that, sir?
Well, maybe you didn't hear me earlier, but we do have patients in the hospital. We have 3 patients in the hospital right now as of today. So that is a new development, but it's not unexpected. I don't think that there's a question that the virus is less lethal. In fact, the trend has been that we may have had a new version that's a little more potent versions of the virus that we may have had over the summer. There has been some talk about whether some strains are more likely to or not. We have actually had more people report significant symptoms than we did earlier this year. We don't know if that's just because it's reaching out to a different population. It's just because of the time of year that's occurring. We really don't have an explanation for it, but we've noticed that trend. I like to think that measures that we put in place, especially the messaging to the people who need to stay isolated because they're high risk, has paid off in the long run, because we've been mentioned many times, and others in public health have also mentioned it over and over and over again. So there's some degree that, you know, the lack of lethality or the lack of a long track record of hospitalizations or you know, deaths could be attributed to the fact that people are paying attention and staying home. And that's kind of a key message to get across and to continue to get across. So it's hard to know lethality of the virus when you have a lot of countermeasures in place and people are actually still implementing them. You know, we see better compliance on a lot of things, but I know a lot of people have taken it to heart and they've just decided, you know, I'm not going to take chances with this. And when you have the people who are most vulnerable doing that, that's a good situation. That means you're probably not going to have high hospitalization rates, and hopefully you're not going to have a lot of people die. That's our goal. So, but right now we have 3 people in the hospital, and that's news for us. We haven't had multiple admissions, I don't think, since, I think there was maybe one day when we had 2 together at the same time. It's been a long time. So it's definitely changed. As far as, you know, restaurant owners, I've said it over and over. I'm sympathetic with their plight. I understand that it just doesn't feel right that they're being constrained in the way they do business to this degree. There's been some discussion at various levels about modifying the tier status to try and accommodate restaurant owners and other businesses a little bit more. The problem is when you're in the middle of what appears to be a surge that may or may not stay contained, that's really hard to make those kinds of calls. So I don't foresee anything in the near future. I don't think we're going to get any special categorization for Del Norte County by virtue of being on the border with. If that were to happen, you know, that would be fine, but I don't think it's likely to take place. And I'm not sure how to approach or who to approach the state at this point for that kind of question. It would be above the pay grade for one thing, but plenty of times we've mentioned the situation of rural counties. You know, the state has hurt us, and in fact, the whole implementation of the regional stay-at-home order is part of an outgrowth of that product. Right now, a good portion of the state, in fact, the majority of the population of the state of California is in a new stay-at-home order because of the new strategy that was released last week. We are not. I mean, that could change day to day, but our region, Northern California, identified us as a region that has some shared interests in terms of what can happen in our county. So we're not there yet. But being in the tier 1 status, the purple tier, is tough. There's a lot of constraints, and I'm sympathetic, but I don't know what else I can do. You know, I'm mandated as a local health official to follow the state mandates as they are handed out to us. And that's kind of our position. That's been our position from the beginning. We can to try and modify it, but right now I don't think much is going to change. There's just too much going on and too much risk to the whole state.
Well, I just want to respond to a couple of statements you just made, Dr. Raywald. Again, people are listening to you and they are staying home. And that has some unintended consequences as people protect themselves from the lethality or less lethality of this COVID-19. I mean, there are businesses that are, sympathy notwithstanding, Dr. Raywald, there are businesses that are tragically going under. I can only refer you to just look around at a restaurant, a major restaurant, I won't mention its name, has gone from 40 employees down to 3, and they're going out of business. They're not going to make it. And that's a form of lethality. When we have businesses that are dying in our community, businesses that create taxes and jobs. And I appreciate the fact you mentioned we have 3 new cases in the hospital, but I don't think there's been any new deaths. It's just the one. And without flirting on that line, the flexibility of people to enjoy life is almost nil here in Del Norte County. So they drive 26 miles north and they go out and have a nice dinner, probably save a marriage or two in the process. So you're my conduit to the State Department of Public Health. You're my conduit to the governor. Your opinion matters. People are listening to you. And what I hear and what I see now is that this community is dying as we look at it. And businesses are hurting and they're not going to make it. And what's left after this COVID virus leaves is something that we all don't want to maybe recognize. So I appreciate your continued vigilance in pleading our case to the State Public Health Department that there are exceptions to these one-size-fits-all rules, which affect tiers. They affect human beings, not just the 3 people in the hospital have great sympathy and empathy for. Thank goodness they're not dying. But at the same time, we closed our community down. And that is dire to me and dire to the people that have called me. It's not just me talking to you right now, sir. It's the hundreds, well, it's not hundreds, but so many businesses have called me. And please do what you can to get us open again. We're not making it. So I hope I can communicate that to you and you can communicate that message to Sacramento that what we see here is not very pretty, and it's the unintended consequences are killing a lot, may very well kill a lot of people, but not from the disease. So I appreciate your listening. Thank you, sir.
Thank you. I appreciate your comments, and we'll continue to do what we can. It's a multifaceted effort, though, to influence state decision makers, and we will continue to do what we can.
Chair Hemmingson, may I?
Yeah. Go ahead.
No, it's not Dr. Raywald's job to present our case, Sacramento, or those that are governing the oversight of this. It's Dr. Raywald's job under these state mandates to implement the best he can under these restrictions. It is our job as elected officials to spread that word in Sacramento and try to get the ear to have some of these restrictions that are very heavy burdens on our economy here, our children. It is our job to express those considerations to Sacramento. And we all need to be doing our part to do that. I'm not exactly sure how that rolls out, but in my specific efforts with RCRC and CSAC, I know Jerry has also, we've been trying to spread that message. And I think, a month ago, we got the relief we were looking for with 106,000 exemption. But we're back in a state where the tiering system and the new regional rollout has really restricted a lot of the behaviors that our businesses and our children were relying upon to get back to some sense of normalcy. And I believe Dr. Raywald, in this, since it has started, has become extremely educated about the impacts to Del Norte County, both on its people, on its demographics, and also on our businesses. And he's expressed those and has stated as such the sympathies towards those businesses. But it is our job to make that declaration, whether it be through proclamation or resolution, to express Del Norte County's opinion about how best we should manage this virus as it moves through our community. And we could do that with recommendations from Dr. Raywald. And I, for one, would suggest that we take an educated approach, and maybe in January on our next agenda, we have a more forthright discussion about the impacts of this virus to our people, to the demographics, but especially to our children and our economy, which are getting left behind and which many won't recover. So I will be looking towards Chair Hemmingson to hopefully put on our agenda for our first meeting in January, some form of discussion around this where we could pay attention to those businesses that have all called us up personally and said, hey, I need help. I want folks to know here in Del Norte County that this board is listening to them, and we're going to do whatever we can to try to have some form of balance as we move forward. So that's my statement, Supervisor Hemmingson. Appreciate it.
Thanks, Chris. Yeah, I agree with you that we need to, along with Dr. Raywald, work together to get that, get a policy in place. Bob, you had something else?
Yes, Dr. Raywald, I have a classification question for you. We have a number of employees that work at Pelican Bay State Prison. A number of those live in Brookings. How are they classified when they get the virus? Are they classified as being your responsibility because they work in California? Or are they Curry County's responsibility because they live in Curry County?
Well, their case numbers would be attributed to their place of residence. So if you're wondering whether they're counting against our tally for total consumption or not, that's how it's done. But as I mentioned earlier, we often are working with Curry Public Health to kind of problem solve these cases that cross the border, because it goes the other way too. We have people working on this side of the border who work up in businesses up in Curry. And generally the case is attributed to your place of residence rather than a workplace. Even though it's identified in a testing site in California, it still funnels back to the place where someone resides.
Okay, thank you.
Lori, did you have anything you wanted to? Yeah, go ahead. You're on mute.
Yeah, there he goes. Once again, Dr. Raywald, I just want to say thank you. I know you were taking a beating recently, which was completely unnecessary and unwarranted. You guys are doing a great job. You're right. Your nurses go unrecognized, and they are the backbone back there doing all the heavy lifting and all the work. So kudos to all of them. And I hear what you're saying, Chris and Jerry, but we haven't gone unheard. When they did the regions, that showed that they were kind of listening, maybe not to the extent that we would like them to listen, but being separated out from LA and SAC and the other greater areas and putting us into 5, I think saved us a little bit more. I would hated to have been bunched once again in that ruling. So again, they may not be listening to us completely at Sacramento 100% where we want them to, but they are listening, and that was proven. And thank you, Dr. Raywald, for all your hard work, and thank you to all your nurses.
I appreciate that, and I'll pass the word along to them because they will love to hear that as well.
Yeah,
Thank you all. Yeah, Dr. Raywald, I agree. Thank you very much. I do have just a couple of real quick questions. You mentioned that we're maybe going to get a small amount of this vaccine. Do you have a number?
The number's been moving around, so I don't know if I can hang my hat on anything I can tell you today, but as of yesterday, it's going to be about 450 doses.
Okay. And then once a person gets this vaccine, does that mean they'll no longer have to wear masks? They'll just go on like pre-COVID?
I don't think so. We have not made a distinction yet between people who have recovered versus people who are still susceptible in terms of mask wearing and precautions. And one of the reasons is we know that people can get reinfected down the road because we've seen it happen. We've even had a couple of cases in Del Norte County where we're quite certain they were reinfected. So that's happening more and more. We think that the experts are telling us there's still a window of about 90 days that you can expect. You're not likely to get reinfected. You can potentially still spread the virus. It's just that you don't think you're likely to have a bad outcome. And the hope is that whatever degree of infection you have the second time around is not as bad and you're not going to spread as much virus as the first time. But honestly, everybody in the world is still learning about this right now. This particular question, we just don't have good answers yet. But
great.
We're going to assume that after a vaccination, you'll have immunity, but it may be temporary, just like recovering from the first infection, the first time you get this. And that down the road, you would potentially get reinfected or get infected after the vaccination. It's just hopefully that it will not be a bad or serious infection, be a mild infection.
Right. And then you say this first vaccine that's going to come out is a 2-dose process. How far apart are the doses?
3 weeks.
Okay. All right. And then
Second vaccine, the Moderna vaccine, is also a 2-dose process, and that's a 4-week interval.
I got you. Okay, and then like Supervisor Cowan was saying, appreciate all your hard work and all the hard work of your staff, all the nurses and everything. So appreciate the report. With that, we're going to go on next time item. Yes. Do we have
I do have hands raised for public comment.
Oh, okay. Let's go ahead with that then.
Okay. Linda, you are on. You just need to unmute your mic.
Good morning. This is Linda Sitter. I live in the county. I don't know. You guys, have you not been watching the news? In Southern California, they shut down everything, and 8 county sheriffs came out and said, we're not going to enforce this because the governor himself does not shut down his business. The governor goes out and has dinner parties. And we're all aware of that. Yes, we have to social distance. Yes, we have to wash our hands and wear a mask or a other little doohickey thing. But shutting down the businesses up here is ridiculous. This is flu season. And there's a lot of false positives going on up here as well. So I don't understand, Dr. Raywall. I mean, I know it's your responsibility to inform about situations, but really, I would like to hear if our sheriff is going to enforce shutting down businesses. We've got to get through this. It's a flu. And I don't believe we need to be causing economic harm to our businesses. It's that you guys been crying wolf all year long. And now the flu season's here and people are actually getting sick. And now let us get herd immunity by connecting with one another. Because like the 2 supervisors said, people are going to go up north and we're going to go out to dinner. We're going to buy our groceries and whatnot else. Just because you shut a restaurant down, which is practicing better distancing within the restaurant than going to Walmart or to Safeway. I mean, there's herds of people everywhere. So there's no difference. Shutting down these restaurants and bars is totally outrageous. And you guys need to, the governor cannot take away the money for COVID to our counties. That's already been decided in court. Excuse me. That's it. Thank you. I'm done. Hello?
Jerry's froze. Chair, are you there?
He's froze up.
I have another public comment. I don't know if we want to wait till.
President Cowan can lead into it. She's vice chair.
Go ahead, Kylie.
Thomas, you are on. You just need to unmute your mic.
Okay, is this the public comment period on any item, or does it pertain to what's being discussed?
It pertained to Dr. Raywall's report.
Okay, so we'll have public comments later on then in this agenda, this meeting. Okay, I'll hold my comment until later.
Chair, I don't see any other public comments relating to Raywald's update.
Okay. So thank you, Dr. Raywald. Appreciate your time.
And thank you to all of you.
Okay. Okay, Assemblymember Wood. Are you, I saw your face pop in here a minute ago. Are you still around?
I am. I'm trying to get this to start the video. It won't start the video. So the host has stopped the video. So.
Uh-oh. That's.
All right, let's
our
try
host.
this again.
There you are.
Oh, there we go. Okay. All right, good. So you guys were apparently in control. So anyway, good morning and thank you for the opportunity to be with you this morning.
Well, we wish we were in control.
So somebody had control of something over there, and it wasn't me. So thank you very much, Mr. Chair and members. Before I start, I'm going to give you a kind of an update, and then I'm obviously open for questions, and love to hear those from you. I just want to acknowledge those two members who are going to be leaving. Miss Lori Cowan, I wish you the best in your future endeavors. It's been a pleasure working with you, and also Mr. Gitlin, wish you the best as well as you transition to something new in life out there. And I thank you very much for your service, and especially to the residents of Del Norte County, as well as the greater state of California. Also, I know that you'll have some new members joining you. And a future opportunity to welcome them. I do want to say, and just in my comments, and express my appreciation for the difficult job that Dr. Raywald has. I've been listening to the comments here and concerns, and my interactions, I found him to be incredibly responsive, incredibly knowledgeable. You're very, very fortunate to have someone of his caliber as your public health officer. And I have tremendous respect for him and what he's trying to accomplish for you. So it's been a difficult job, obviously, but you're very fortunate from my perspective. In general, it's been a tough year for all Californians. Actually, it's been probably one of the most horrible years for all Californians that any of us can remember. We've had wildfires. We've had, not in my area, in Sonoma County where I live, public safety power shutoffs, budget and revenue setbacks because of our state budget deficit. And then essentially since March, we've been under siege with COVID and everything related to COVID. And in the background of all this, homelessness continues to be a big issue. Housing, substance abuse. We are on course for the largest number of overdose deaths in the history of the country this year. Also, I believe a manifestation of what's happened during the COVID pandemic. And then we're also waiting to see what happens with the Supreme Court decision on the Affordable Care Act, and whether you like all the aspects of the Affordable Care Act or not. If the Supreme Court invalidates that will be about a $20 billion budget hit to the state of California, and that will be a significant challenge for us as well. Our budget is actually better than we expected, but not great. And the challenge that we have is that we really do need federal resources to support us. Senator McGuire and I worked to push the state as much as we could to get some of that early federal money that came out in the early stimulus packages to not a lot of avail, quite frankly, and that's been a huge frustration. Jurisdictions that were over 500,000 people got federal stimulus money directly, but everyone else had to fight tooth and nail to get the resources. And quite frankly, our smaller counties like Del Norte struggled to get even a proportional share of that. And that's been a real sore spot for me and the senator as well. I do want to say that, I know that masks are not popular in every jurisdiction, but they do help. And I would just encourage people that if everybody wore a mask, did the social distancing, washed their hands frequently, we would really minimize the impact of this. And I have serious concerns about this because of the size of some of our smaller counties. Del Norte County does not have the ICU capacity that Oakland or San Francisco or Los Angeles does. And so a few cases in ICU will quickly overwhelm the healthcare system in Del Norte County. And so these preventive measures mean a lot. And I know they're not popular with everyone. And I don't particularly like wearing a mask myself, but I'm doing it. Fortunately, I'm in a Zoom meeting right now, and I don't have to wear a mask because there's no one near me. But it is a critical component here, and I just wish that everyone would just, if the sooner we all follow some of these rules, the faster we're going to get out of this. Vaccines are indeed coming, and there's no question about that. But that herd immunity that we talk about is also related to the vaccines. And that means that we're going to need to get upwards of 90% of the people to have a vaccine to recognize the true value of a vaccine. So if we don't get a big number of people on the uptake of the vaccine, we are not going to be able to knock this thing out as quickly as we can. So I'm disappointed in the small number of doses that are available. Quite frankly, 450 for the entire county is a really, really small number. The number statewide in the first grouping is 327,000 doses. And remember, it's a two-dose regimen. So people are going to have to follow through on that. COVID has impacted our kids to a really horrible and dramatic event. And there isn't a day that goes by that we don't get a lot of calls from people on that. Right now, our education committee and is working closely with the state, with the federal, with our governor's administration to begin to tackle some of that. While you may have in some areas, like certainly in the Crescent City area, you've got really good or better than most broadband access. A lot of areas outside of town don't. And so all those kids are getting hit really, really hard. And been working with the state superintendent of education, Tony Thurmond, to try to get more broadband coverage out there. And we are, as the assembly, making broadband a huge priority this year moving forward. EDD, three letters that go together that are a graphic illustration of some of the dysfunction we have at state government, and we in the legislature are outraged over what's happened, and continue to push the administration to fix it and fix it now. And we will continue to keep the heat on until it is fixed. But it is a significant problem. If you're unemployed and can't get your benefits, but if you're in prison and have figured out a way to defraud the state and get the money before other hardworking folks who have lost their jobs can get it, we got a serious problem here, and we need to really, really fix this and fix it quickly. Our rural counties have been hit harder, and part of it is because everything seems to be that comes from Sacramento is often a one-size-fits-all. It's the same with the federal government as well. And every day I advocate for flexibility and the ability to use resources in counties the way the counties need it to be used without a lot of strings attached to it. And it is an uphill battle. As I have the honor of representing 5 counties. There are 27 of my colleagues that represent Los Angeles County. So I'm fighting a huge battle every day uphill against people whose interests are different than they are for us in our counties. We did have some legislative successes this year, in spite of the fact that everything was dramatically scaled down. My health committee would have typically heard about 150 bills. We heard 36, and that was typical throughout the legislature. A lot of things were put on the back burner, so to speak. But we were able to get some things done that I think were significant. A bill I had that would allow nurse practitioners, after certain circumstances, including a defined supervision period by physicians, to be able to practice independently as primary care providers. A battle that had gone on for over a decade in the Capitol. I was able to get that bill passed and signed by the governor. We introduced a bill after our summer break to allow pharmacists to be able to give COVID vaccine when it becomes available. That was also signed by the governor. We're going to need, once these doses become available, we're going to need everybody who can give an injection safely to be able to do it. And so I'm happy that we were able to do that. We've had obviously throughout the state and a lot of the counties we represent, we see these clusters of COVID cases in skilled nursing facilities. And one of the things that we did in response to that was we need to know when these are happening real time. And so the reporting requirements for deaths have been changed in statute. Right now, they have to be reported by the governor's executive order so that we get a handle on where these cases are in skilled nursing facilities. But believe it or not, in skilled nursing facilities, there was nobody in charge on a full-time basis of infection control. And clearly that's an issue. Well, there will be now. And I think it's important that infection control protocols are kept as to the highest level possible to protect people. We've been supporting wildfire victims and introducing legislation to help push back against some of the insurance industry challenges. I get very frustrated when I see that, a lot of insurance companies want to drop some of our WUI areas, but they're more than happy to insure in areas where the risk is much lower, and I find that really, really frustrating. I call that cherry picking, and I think it's wrong, and I'm going to continue to push back against that. But that battle is going to be going on for quite a while. A big focus this year for me will be around wildfire prevention, in addition to all things COVID, quite frankly. And I hope that we'll be able to be successful. We did have things that didn't go forward, and I think one in particular that I think was significant was, for those folks who want to be able to do home hardening projects, removing vegetation, doing things around their home. CAL FIRE has our Natural Resources Agency have grant programs, but you got to spend the money up front, and then you got to wait 6, sometimes 8 months to get the money back. Now, I don't know right now. I certainly don't have it. If you're gonna have to spend $5,000 or $6,000 or $10,000 and then sit around and wait for 6 or 8 months to get reimbursed for a grant, how you make that work? And we had a bill to try to do that, and sadly, our own agencies pushed back against that. So we're going to continue to push on that because I think it's wrong that we can't do that. We held some informational hearings this fall on consolidation in the healthcare arena, affordability, which it continues to be a huge issue and growing issue, and information exchange systems, which is basically how do hospitals and doctors' offices and other hospitals communicate with one another. And it sadly needs a huge amount of work to make it better. Our activities have been limited. I've been following the recommendations of my county. I've been staying at home more. And so a lot of our work has been through Zoom, which I know all of you have been able to do. I'm in my state office in Santa Rosa today. Otherwise, you'd likely see a cat or a dog or something wandering across the screen here or barking in the background, but I tried to spare you all of that today. And I just, I think we're all getting better at finding the mute and unmute buttons and hopefully finding the right lighting. So I don't have a fancy background like some of you guys do, but I'm doing the best I can. So I'm on a state budget here too. So, but with that, I recognize you have a long agenda, and I do want to let you know I'm happy to answer any questions.
Any questions? Yeah, Bob, go ahead.
Assemblyman, we've been hearing a lot of mandates from the governor, like on a weekly basis, and they affect all of our counties. What input do you, as an assemblyman, have as input to any of these proclamations that come out from the governor's office?
Zero.
Yeah, that's really a shame.
And that is, I have, and I'm not, I'm just simply stating the fact that we have not, we really have not been engaged on a lot of these decisions. We often find out a few minutes before a proclamation is going to happen. But we haven't been, as legislature, look, I'm the chair of the health committee, and I have a healthcare background. I have 5 years of experience as the chair of this committee, but we have not been consulted on a lot of these. And I consistently ask for information, data to support the science, and I've been very, very frustrated.
Yeah, I can see that.
Yeah.
Thank you.
Anybody else got questions? Yeah, Chris, go ahead.
Thank you. Congratulations on your reelection.
Yeah.
It's a good thing. You've represented us quite well here in Del Norte County, and we appreciate all your efforts. A couple points that you made, I want to reflect back upon briefly, if we can. I know you're going to continue spearheading broadband. I'm glad to hear that. But its effectiveness with education, as we have seen throughout this pandemic, is completely failed our children. If you're already in a community like Del Norte, that's demographic is not prone, let's say, to engage in education, these students, as we're seeing reflected throughout rural California, are falling behind, as you've seen in grades, results, absentees. And in speaking with many educators in our system over the last several months, they have made several comments to me that they might as well have not even started this school year because that's how far behind these children are. I'm not entirely sure how to get from point A to point B, but I know our kids need to be back in class. And I'm quite sure you're doing everything you can as assembly member to help us get there. Can we look for your help with getting vaccinations to our teachers as essential workers, essentially on the front lines of ensuring that our children can have equal access to education? Because up here with our demographic, it's quite essential that these kids get back to school.
Well, look, I'm going to push as hard as I can on that. The Governor's Office of Department of Public Health have come up with a tiered system of who's going to get vaccines when. As I said, we, in the legislature, we were not consulted about that. Right now, the emphasis is going to be on frontline healthcare workers and those in residents in skilled nursing facilities as well, where the 40% of the deaths in California have come in from skilled nursing facilities, and that's a pretty shocking number when you think about that. I think a lot of this is going to be, the limitation is going to be on the availability of the vaccine. And then once it's available, it is not dependent on which vaccine. Certainly the Pfizer vaccine requires storage at extremely cold temperatures because it's not stable otherwise. And so there are going to be some significant logistical problems, whether you live in Los Angeles or Crescent City or any other community within California, and how that gets administered. So I think the goal is to try to get it out as quickly as we can to as many people. But I hear you on the education, and my colleague Assemblymember O'Donnell, who's the chair of the Education Committee, is now for the first time been able to actively work with the administration on coming up with some plans around education, especially with our kids. And fortunately, he's a good friend, and I've been in his ear more now than he's ever had it bent for me in the past, because it is a huge issue, whether it's small businesses that are suffering, and kids in school are the two top things we hear about, and we're pushing as hard as we can. We really are.
And this is nothing against the scientists that are putting their head to vaccine distribution, especially around cold storage with the Pfizer vaccine. But, us dairymen have been doing this for generations. We keep semen at temperatures below minus 300 degrees Celsius in liquid nitrogen for weeks on end. And it's just a matter of having that liquid nitrogen timed to be deposited within your facility. I mean, this is not a difficult lift. It's something that could be easily done, having a containment system for it if you're going to use liquid nitrogen to get there. I mean, it's quite practical. But the other point you made, if I may reflect upon it, is on the wildfire piece. You said prevention, and prevention is going to be key, no question about it. But there was some legislation passed that both the Assembly, the Senate, and the governor signed into effect several years ago to help play offense. More specifically, pumping the dollars into the offensive places to get into the WUIs to allow for forest management. I'm wondering if you could speak to that piece of it, more on the offensive play and what the legislature is going to be considering this coming year.
Yeah, first of all, thank you. And maybe we need to get the dairymen out there to help us with vaccinations on COVID. I don't know. What do you think, Chris?
I'm all about it. I'll even loan you a container that keeps this stuff.
All right. Okay. Well, I'll think about that one. As far as the prevention part of it, that was a bill, was Senate Bill 901, and I worked really closely with then Assembly Member Dolly to the east of us, who's now Senator Dolly, and we came up with what we called the Dollywood Plan, and it was $1 billion in over 5 years for vegetation management programs. We got the first hit of it, and then because of lower amount of cap and trade revenues, we didn't get the second $200 million. So we are now we're behind the 8 ball. We're $200 million short of where we were supposed to be with funding a lot of these projects. And so we're pushing to the revenues for the last auction came in better. So we're pushing to get that money out the door that was supposed to get out the door in 2020 and beyond. So we're going to continue to push there, but it's going to take more than that. It's going to take, and I apologize for the dinging, but I can't figure out on this computer how to turn that thing off. It's not my phone, I promise you that. But we're pushing on trying to get that. Look, we're going to spend this year somewhere north of $3 billion on fire suppression, and a tiny fraction of that amount on prevention. Do you see the imbalance here? Do you see what's wrong with this? And yet we as a state budget from year to year, we'll treat the disease, but we won't prevent the disease. And this is extremely frustrating. And so I continue to push on that, because the best way to do this is to prevent this from happening. So I'll keep pushing.
Okay, anybody else got any questions? No other questions? Well, thank you, Assembly Member. I appreciate all your efforts. The fire home hardening issue is certainly a big thing, the funding for that. I appreciate you working on that, as well as the insurance issue with insurance companies not wanting to insure people who are in SRAs and the WUI. That's a pretty big deal. We've got a number of individuals in our community who fit into that, and it's very difficult at times. So appreciate your hard work on that, as well as all the healthcare stuff, and congratulations on your reelection. Very happy to see you seated there.
Thank you. Thanks very much. Appreciate it. And please keep in touch. Obviously, we want to work with you. I spend a huge amount of my time in Sacramento trying to tell people that our rural communities are not like the large urban communities. Give us the give us our proportional share of resources, and give us the flexibility to spend it in the way that's best for our communities, and you'll see real results. And I feel like I'm swimming upstream every day, but I've become a strong swimmer.
We know the feeling.
I know you do. Thank you so much. Okay.
And the hat.
Thank you.
Okay, thank you. I'm going to go back to public comment. I don't know how I mistakenly went over that timed item. I guess my pages were kind of, but I'm going to go back to our 10:05 timed item and go back to public comment. Kylie, do you have any written public comment, or is there any raised hands? I know Thomas Barnes was on earlier. Now is his opportunity for public comment.
Okay, give me one moment. Thomas, you're on. You just need to unmute your mic.
Okay, I believe I'm unmuted.
You are.
Okay. I just want to make some general comments. I'd like to comment on the significant changes that have occurred in our community at both the city level and the county level, which reflects the desire of the community to see needed changes in our leadership. 2 new city council members, Alex Campbell and Bo Smith, were elected, and Jason Greeno was reelected. and a new mayor, Jason Greeno, was appointed. And I would like to congratulate Alex Bowe and Jason. These are significant changes at the city level, and it reflects the feelings of the community as to the desire and need for change. The same is true at the county level, the Board of Supervisors. Everyone's aware that in the last election, 2 new supervisors were elected, Valerie Starkey and Darren Short. One member, Bob Berkowitz, was reelected. Hopefully, this change will bring about much needed independent, community-minded thinking, as opposed to almost all decisions being made by the same 3 supervisors, void of independent thinking, and in some cases, not in the best interest of the community. I believe this is what the community desires and what the community deserves, which is unbiased board, which makes all decisions with the best interest of the community, which is a reflection of what the community voted for. I think that they will serve, or I hope that they will serve their county in the best interest of the county and community, which is what the voters expect and deserve. I also want to thank Roger Gitlin for his years of dedicated service to this county and community. Mr. Gitlin was devoted to improving this county, as evidenced by his involvement Take Out a Blight program and his Pride in Community program. Mr. Gitlin, thank you for your dedicated and invaluable service to the community. I hope you stick around and stay involved. Also, the county has recently issued an RFP. It's important that any and all changes made to this RFP are displayed and announced publicly to ensure constructive notice, to ensure fairness, and avoid confusion. I have no other comments. Thank you for your time.
Thank you. Kylie, any other public comment?
Yes, Craig, you are on. You just need to unmute your mic.
Okay, can you hear me now? Okay, I'm just doing a brief report on the dog waste stations that you approved. I think it was back in September. We visit the areas out at Point St. George about weekly, and looks like things are going really well. The supply of bags decreases slowly, such that we replace them about once a month. There was one incident last week where somebody had taken all of the bags out of all of the stations at one time, so this was an act of vandalism. They didn't damage the things, they just ripped all the bags out. So we replaced them, and that was like 10 days ago, and it hasn't happened again. I'm hoping that was an isolated event. There it is for the update. Looks like it's working, and I would encourage city and county to look into placing them at other key locations where they're much needed, like down at South Beach on Anchor Way and in the harbor area, and then perhaps one at Pebble Beach. That's all I had to add. Thank you.
Thank you. Kylie, any other further public comment?
Chair, I'm not seeing any at this time.
Okay, we're going to close public comment. We're going to go to our 10:45 timed item, which we're a little bit behind, which is to consider the appeal of the Planning Commission's decision to deny a use permit. Taylor, I saw you were on earlier. Were you going to speak to this?
Yeah, I'm on. Yeah, thank you. I was just going to quickly introduce this. I provided a pretty lengthy board report with quite a bit of detail in there. I did just.
Thanks a lot for that.
Sorry.
Thanks a lot for that. That's really.
You're welcome.
Really
yeah,
a lot of reading.
That's my goal. Yeah. So this was to be clear, we don't have a lot of planning commission appeals. In general, this is a very rare thing, but it is a process available to those that feel aggrieved by the decision of the planning commission, whether they be an applicant or a member of the public. So here we are. This was an appeal by Mr. Nato Flores on his use permit amendment application in October of this year, which would have allowed for him to construct on-site stormwater retention in lieu of having to construct or develop off-site improvements to carry stormwater generated on-site to an off-site public facility. To be clear, this use permit was approved in 2019 for a planned community, which provided an entitlement for an additional 15 residential units to be developed on the property. And that use permit was approved with the current conditions requiring off-site drainage improvements. The applicant made clear in October that there was an engineered alternative. This on-site retention of stormwater was a viable alternative from an engineering perspective. And he made clear at that time as well that the project, the planned community, may not be economically viable if this alternative is not allowed to be permitted. So the decision really comes down to the Board of Supervisors at this point. And I think Mr. Flores is available to present his case. I want to give him as much time to present his case. I also do want to state that we did provide the entire public record of the proceedings. So we are available to answer questions after Mr. Flores presents his case. So thank you.
Mr. Flores, are you on?
Here, I see he's on. I'm not sure if he's just figuring out how to unmute his mic. I don't know if that's something IT can help out with, or if he has to do it on his side. I don't recall.
He will have to do it on his side. I see he's connected through a phone, so he can press *6.
Is this representative from Stover Engineering on at all? Ryan?
It looks like NATO's unmuted.
Okay.
This is Ryan with Stover Engineering. I'm on as well.
Thank you, Ryan.
So before Mr. Flores gets on, I guess, Taylor, run us through this. What are your concerns about the alternatives?
From a community development standpoint, or from an engineering standpoint, at least, it seems that the alternative does address the management of the 25-year storm, just as, constructing offsite improvements would. So, the concern of whether, the project is economically viable or not is a large one, because it would promote, a fairly large amount of housing in the area.
Yeah, I agree, but were these options presented to the Planning Commission?
They were, yeah. The options that you see in the board report here is option 1 and option 2 were presented to the Planning Commission.
And so if you didn't have a concern, or if the engineering would make them work either way, I'm just curious as to why the Planning Commission would go that direction. I'm a little bit concerned with that part is all, I guess.
Yeah.
I didn't have a feel of how things were going, or, without being there.
Sure. Yeah, there were discussions around, the fact that the retention pond itself would be open on the site. So, during wet years, that there would be a visible pond on site up to, say a foot in depth. So concerns were raised about, say children getting into the pond or playing in the pond. Concerns were raised about, material being lawn clippings and whatnot, reducing the effectiveness of the pond. I think at the time though, Mr. Young, the project engineer, addressed a lot of those concerns. I mean, for one, fencing could be established around the perimeter of the pond to prevent, trespass, people driving in there. Mr. Flores, offered to sign an agreement, a maintenance agreement, so that the pond would continue to be effective. There was, I believe, one public comment not in support of the on-site retention. So from one of the neighbors, and that may have played a factor in the decision. But
Supervisor Hemmingson.
Yes, go ahead.
If I may, and Taylor, really appreciate the very detailed explanation of what took place. Although I do oftentimes respect the Planning Commission's decision, in this case, finding the balance to increase housing in our community is extremely important. And there's no question that as appealed and with the designs by Stover Engineering that were being represented by Ryan in this case, I see no reason for this board at this time not to approve item 2 on our agenda, which would be to approve the appeal as requested by the applicant and amend the use permit conditions, item number 19 and 30, as shown under option 2 in the board report. And I'd make that motion at this time.
I'll second it.
Okay, I have a motion and a second. Is there any public comment on this, Kylie?
Chair, I have a written one, and it is from Jerry and Rebecca Young. And it says, honorable board members, this letter is in reference to the appeal of the use permit amendment filed by Jose Flores Cortez for the property APN 116160023 located at 1600 Northcrest Drive. Our property borders this property on the west. It has now been a little over a year and a half since the Planning Commission meeting where the use permit was approved, and we have seen little cooperation from Mr. Flores Cortez. He removed our fence, which the previous owner of our property had built over the property line before that first planning meeting, and it has not been temporarily replaced as promised. The planners directed him to construct a 6-foot cement wall as part of his use permit to keep his renters and their activities off our property permanently. There has been no sign of this yet. Our concern with the drainage is that his property is much higher than ours, and during heavy rains, it drains onto ours. With the increased amount of paving and cement and the number of buildings he plans to erect, there will be less area for the water to be naturally absorbed. The settling pond he proposes will be a breeding ground for mosquitoes, and we have no assurance that it will work. We feel that since others who upgrade and improve property along our county roadways are required to make needed upgrades to the systems they use, it is only fair that they should be also. I'm enclosing a copy of a letter to the planners at his appeal in May. Thank you for your time and attention to this matter. I'm just going to read, it's a small letter that he sent to the planning commissioners, and it says, we are writing to address our feelings regarding the amendment to use permit and all the information. It says, we are surprised that this has even come up since the original meeting was held on May 1st, 2019, and the stipulations were placed at that time. Since nothing has been done since that meeting, we really feel that there's no reason this amendment couldn't be tabled until this COVID-19 crisis is over and a meeting could be held where everyone can attend and questions could be asked and answers given in a face-to-face setting. We think it was made clear at the 2019 meeting that water was not to drain on our property. With the improvements Mr. Flores will be making, there must be a plan to place to carry that water away. Our property is lower than his, and the additional buildings and paving will only make drainage worse. We realize that development is in progress, and we have been more than patient. Mr. Flores Cortez removed the chain link fence that separated the two properties previous to the May 1st, 2019 meeting. He was to construct a 6-foot cement fence in its place. There is still no fence. We request that our rights be considered and that water from the project not be allowed to infringe on our property or use thereof. We believe that grading and draining the property to be developed toward Northcrest Drive and the storm drains is the only viable solution. And that was the letter they sent to the Planning Commission previous to you guys. Okay. And that's the only written I have regarding this appeal.
Are there any raised hands or any other public?
I am not seeing any raised hands at this time.
Taylor, can you speak to the fence issue on why that hasn't been put in, or is that not required, or?
So that was an issue brought up during the initial planning commission meeting in 2019 to grant the use permit. And that was Mr. Flores actually volunteered to construct a wall as a result of the Young's public comment and the ensuing discussion. So that was a condition of approval on the use permit. The use permit has not been issued yet, but that will be a requirement when the condition is, or when the use permit's issued. So.
And then speak to the runoff.
Can you guys hear me yet? This is Mr. Flores.
Yeah, go ahead, Mr. Flores.
Okay, so the fence was brought down because we need to move it back to the proper property line. It was actually 15 feet into the property, and it will be put back as a chain link fence temporarily in January, and then of course we will construct the block wall that that is part of the conditions.
Okay, and the runoff in this engineered plan is not going to affect Mr. Young's property. Is that correct?
Well, I made sure that I hired an engineer who knew the area, who has done this particular design before in the area. And we're using permeable surfaces actually everywhere, so that when the water does fall onto the driveways or the sidewalks, they are permeable and the water will go through them. I feel that this is a more environmentally friendly solution because we don't put any additional load onto the existing stormwater system if we can absorb it right in our property. And if you were to look at the details of the design, I know you don't have to, but the detention pond is a total of 12 inches deep, only about 1,200 square feet. It slopes gently and just becomes part of the lawn. And, you know, we have a lawn service that comes there every twice a month, I think, and they mow the lawn, and it'll continue being done that way. So you won't even be able to see it unless you really look for it.
Great. Yeah, and just on a note, I really appreciate what you've done with the property, cleaned it up, and gotten that presentable. So I appreciate that. And there is a need for low-income housing, and appreciate your work going towards that.
Well, thank you very much.
So with that, we have a motion and a second. If there's no further discussion or questions.
Yeah. Chairman, I do have some discussion on this issue before we move on. Taylor, are you still there?
Yes, I am.
Okay, and Mr. Flores, are you still on board?
Yes, I am.
Okay, well, first of all, let me just address on a general comment. This is the second time our Board of Supervisors is overturning an appeal from our Planning Commission. These are our appointees. And this is a 4-0 vote with one exemption, with one recusal, Commissioner Rested, I believe. So there isn't even, on this 4-0 vote, it's not even a 3-1 or a 2-2. There's really, it's kind of clear that the 4 city members have an opinion. And I don't like, just on face value, overturning our designated appointees' official position. Secondly, with regard to Mr. Flores, could you talk to us about an area that's not been discussed of the kinds of construction? And I'm looking at the narrative. There's a single family residence and 8 small bungalow units. And I understand there is a shortage of housing, but are you using some kind of container capacity and some kind of construction as to these housing units, or are these additional 15 units going to be the same kind of construction you used for the 8 bungalows and the single family dwelling? Or please address this as what type of housing you're using on this. I have some concerns about the overall impact on the neighborhood.
Yeah. So the existing units are single bungalow units. In other words, they don't have a bedroom or anything. They're just singles. What we want to do is use two 20-foot high cube shipping containers side by side as the one bedroom dwelling units. They will have a pitched roof on them with gable ends. So they won't look like shipping containers. They actually will look like one bedroom cottages. They'll have windows, doors, and they're going to be partially constructed in a factory, but they will be finished on site. So we will have local inspections for the interior framing, the interior rough electrical, rough plumbing, the roof structures. So even though they are modular units, they will look like they have vertical siding on them.
Are these properly insulated? I mean, I'm just
Yes,
not.
we plan to use 2.5 inches of closed cell spray-on foam insulation, which gives us an R value of 20 on the walls, and then in the roofs below the gable roofs, we'll be using R40.
Well, I've heard from a number of your neighbors, and not just Mr. Young, who I've heard from before, but the other neighbors to the south of you, and they're none too happy with the kind of construction that you're about to engage in. So I have those concerns to consider in terms of the impact on the neighborhood in which you're developing additional housing. Though I certainly appreciate that we do have a housing shortage, I'm not sure this is the answer to that question of how do we satisfy the housing shortage in Del Norte County. So I appreciate your frankness and your candor in letting me know what you plan to do. I do have some issues with the drainage issue. I'd like to see it done in a way other than permitting conditions on 19 and 30, as was already discussed. So, but thank you very much for your input.
Yeah, and as to the look of the units, I can get you some photorealistic renderings of them so you can see that they are going to look like, typical one bedroom cottages. They're going to be very pleasant looking, actually. My philosophy is I don't want to rent anything that I would not live in myself. That's my philosophy here in Los Angeles, and it's my philosophy everywhere that I own units.
No, I appreciate what you're saying. Now is not the time for me to access these units. That was done before the Planning Commission. And as I said, I'm loath to go against a 4-0 Planning Commission vote. It minimizes the importance of our appointees on the Board of Supervisors to represent us. And here we are doing, in my recent memory, this is the second overturn that is being sought. The first one was successfully overturned. And I have to share that with you, that I have great trust in it and in the appointees that are there. And you've got a 4-0 vote against your plan. And I think your response was to do it any other way was not economically reasonable or feasible. I'm not so sure that's the answer I'd like to hear as you move forward on this project, though I'd like to see it done. I would like to see that this be presented to the Planning Commission in a way which embraces the community and not looking for shortcuts because of economic reasons. So I share that with you at this point, and I hope you appreciate that.
Yeah. And I want to address that point about the commissioners and the number. One of the commissioners was obligated to recuse himself, and he did not. And I addressed that in my appeal to the board here. And I believe that there was politicking behind the scenes because we presented an engineered plan with calculations that rely on Newtonian mechanics to prove that the water would not cause any ill effects at the property. And all that was just disregarded. It was for other reasons, which I don't understand. I mean, we send rockets to the moon based on engineered calculations. We can't deal with water based on engineered calculations. I think we can, but that's not, I don't believe that was the intent I believe there was politicking behind the scenes.
Well, maybe so. Maybe that's just the way of life, Mr. Flores. But needless to say, you do not even have one vote of support, even if you are talking about a second recusal. I'm looking at Commissioner Restad recusing himself for the appearance of impropriety should he partake in this vote, which he's not doing. So that's commendable. Now, the other one, I don't know what you're referring to, but it still leaves you, even on that argument, 3-0. You don't have a vote of support from our planning commissioners on this, based on what you've presented. I think that's chilling, and I think that's a message to you to come back and return this project to the planning commissioners in a way that doesn't come to the attention on the purview of the Board of Supervisors. Because as I mentioned to you, the second and final time I'll say this, I'm loath to reverse such a decision on a 4-0, or even if you, using your argument, a 3-0 vote, because 3 is a quorum, on a 3-0 vote or a 4-0 vote, you don't have one vote of support for this project the way you presented it. And I think that's a telling discussion you should consider very seriously.
Okay, has anybody else got anything else to say? And just, I don't think we're supposed to worry about how this thing is constructed. We're talking about the drainage. And if there was an issue with how they were constructed, that would have been dealt with also in this use permit, I'm assuming. Taylor, is that not correct? There was no, there was no concern about the way the construction was. And if he would have done the construction the way it was and the drainage the way it was incorporated into the original use permit, then there would not be an issue. He is just looking for an alternative that may make his units work better financially so that he's able to do it. Otherwise, he's not able to do it and we're out. So just curious, is that not true?
Well, so speaking to the units themselves, I mean, that the type of units could definitely have been, addressed at the planning commission level. Residential units are required to comply with, California building code, and that's one of the conditions on the use permit. So it will, each unit will have to comply with current building code. As far as the drainage goes, the original condition, does comply with county code that, connecting to an offsite public drainage system is, part of the intent of county code for sure. And yeah, the applicant is requesting an alternative that, feels has been shown to work. So that's.
Yeah, he's not asking for something special as far as the building of these. He's only asking for a different solution to the drainage. Is that not correct?
That is correct. Yeah.
Okay, so with that, if there's no more discussion, Kylie, we have a motion and a second.
Kylie, would you repeat the motion one more time? I want to make sure I'm hearing it right.
Kylie, that's okay.
Okay.
This motion is to approve the appeal as requested by the applicant and amend the use permit conditions number 19 and 30 as shown under option 2 in the board report.
That's your understanding of the second, Supervisor Cowan?
That is my understanding, and I do still second that.
Kylie, would you poll the vote, please?
Supervisor Berkowitz?
Yes.
Supervisor Gitlin?
No.
Supervisor Cowan?
Yes.
Supervisor Howard?
Yes.
Chair Hemmingson?
Yes.
Chair,
Okay.
Thank
you. Yeah, go ahead.
I believe a public comment, there was a glitch or something, a hand was raised, it came up after you closed public comment. I believe we have one more person. Is it appropriate time to let that person speak at this moment? Or did you want to wait?
Is this for public, just public, general
Yeah,
public?
just regular public comment, yeah.
Yeah, I'll allow it.
Okay. Linda, are you there?
I am. Yeah, I don't know what happened, but you guys didn't see my hand raised or something. And I don't really feel that it's appropriate to discuss it when you got another discussion going on, but I'm going to go ahead and say it. I just wanted to let you know the right to petition government and redress grievances is the right to make a complaint. And with that said, Mr. Serena demonstrated his guilt to FPPC recently. First, he attempted to explain to FPPC how the campaign mailers for Measure R were informational only, and to qualify this statement, he pushed the blame on me and one sitting supervisor who was elected twice and served 8 years for District 1, which is Roger Gitlin. Common practice of incarcerator do these little things. They say, look over there, not at me. Mr. Serena stated I weaponized myself by using FPPC complaints to turn public against elected officials. That is called projecting, because it is the county who uses taxpayers' money to weaponize themselves for their own benefit. I have filed 4 complaints this year. The most recent one was declined. However, I have submitted a request for reconsideration with legal authority. The rest of the complaints submitted are still being investigated. Chris Howard currently has 2, one from me and one from San Jose. I don't know what that's about. The only reason I generate FPPC complaints is because no one else takes the initiative. People work, kids are in school during the convenient hours of 10 a.m. There's no worthy newspaper monitoring your decisions or investigating your actions. Most people don't know where to begin. 3 out of 4, if you think that this is a game for me, you're sadly mistaken. I have better things to do with my time than to watch a body of government that has no integrity and spends taxpayers' money on a whim to benefit themselves and not the county. After all, that 1 cent sales tax that was voted in goes into a general fund to spend on frivolous outings to Japan or other functions instead of going into specific accounts. Thank you for your time.
Was there anything else, Kylie?
Chair, not that I'm aware of. Thank you.
Oh, all right.
Supervisor,
Yes,
may I make a quick statement to the board?
sure.
In relation to the FPPC violations, we will get the information out soon, but the Enforcement Division of the FPPC rejected those complaints and found that there were no violations. And I'll just note that and leave it at that.
Thank you. Thank you, Jay. Appreciate that. Okay, we're gonna move on then to our general government items, starting with item number 22, where we're gonna hopefully adopt a statement of votes cast in November 3rd election. Looking for a motion.
I'll make that motion.
Second.
I have a motion by Vice Chair Cowan and seconded by Supervisor Howard. Any public comment, Kylie?
Any
discussion from the board? Kylie, please poll the vote.
Supervisor Gitlin?
Yes.
Supervisor Berkowitz?
Yes.
Supervisor Howard?
Yes.
Supervisor Cowan?
Yes.
Chair Hemmingson?
Yes. Okay, item number 23, approve and adopt the agreement for preparation to administer and operate the county's transactions and use tax ordinance. That's number 1. Number 2, the agreement for the state administration of county transactions and use taxes. And 3, a resolution of the Del Norte County Board of Supervisors authorizing the county administrative officer to execute agreements with the California tax. And 4, a resolution also authorizing the examination of transaction, sales, and use tax records as requested by county council. or county administrative officer, excuse me, county council and administration.
Move to approve as read into record by Chair Hemmingson.
Second.
Thank you. I have a motion by Supervisor Howard, seconded by Supervisor Berkowitz. Is there any public comment?
Chair, I'm not seeing any public comment at this time.
Is there any further discussion? Kylie, please poll the vote.
Supervisor Cowan,
Yes.
Supervisor Gitlin,
Yes.
Supervisor Berkowitz,
Yes.
Supervisor Howard,
Yes.
Chair Hemmingson.
Yes. Okay, moving on to item number 24. Approve and authorize the newly hired licensed vocational nurse 2 to start at step C. I guess
Motion to approve.
Second. Okay, can I get a second?
Supervisor Berkowitz did second.
Okay. Supervisor Cowan, motion. Supervisor Howard, second.
It was Supervisor Berkowitz. Chair.
Oh, I'm sorry. Supervisor Berkowitz.
Second,
Oh,
yeah.
You both must have talked over each other.
His
is there
line
a public
out.
Kylie?
I don't have any public comment at this time, Chair.
Being no public comment, any further discussion? Please poll the vote, Kylie.
Supervisor Howard,
Yes.
Supervisor Gitlin,
Yes.
Supervisor Berkowitz,
Yes.
Supervisor Cowan,
Yes.
Chair Hemmingson.
Yes. At this time, we're going to adjourn as the Board of Supervisors and reconvene as the Board of Equalization and approve the assessment appeal withdrawal application for APN 800-000-382, that's Safeway, as requested by the Assessor's Office.
I'd make that motion to approve.
Second.
I have a motion by Howard, second by Berkowitz. Is there any public comment, Kylie?
Chair, I'm not seeing any at this time.
Thank you. No further discussion. Please poll the vote.
Supervisor Gitlin,
Yes.
Supervisor Cowan,
Yes.
Supervisor Berkowitz,
Yes.
Supervisor Howard,
Yes.
Chair Hemmingson.
Yes. Okay, we're going to move on to budget transfers. Here we have two. So we're going to adjourn as the Board of Equalization and reconvene as the Board of Supervisors and go on to the budget transfers, which is to approve and adopt budget transfer number 12-01 in the amount of $5,300 within public health budget unit to purchase the required ultra cold freezer for COVID vaccines. And number 27 is 12-02 in the amount of $406,486 within the public health budget to budget unit to restart the Women, Infants, and Children program in Del Norte County.
I'll make that motion.
Okay,
I'd second that motion.
I have a motion and a second. Any public comment, Kylie?
Chair, I'm not seeing any at this time.
Okay. Then if there's no further discussion, please poll the vote.
Supervisor Gitlin,
Yes.
Supervisor Berkowitz,
Yes.
Supervisor Howard,
Yes.
Supervisor Cowan,
Yes.
Chair Hemmingson.
Yes. Okay, we're going to move on to legislative and budget issues. Consider miscellaneous legislative and budget matters pertinent to the County of Del Norte. Authorize the chair to sign and send appropriate letters with respect to matters pending before the state or federal governments. We have number 28 to approve the public safety realignment plan for 2021 as requested, or 2020 and 2021 as requested by the Community Corrections Partnership Chairman.
That would be the chief probation officer, and I
Is
believe
that
he's on.
Lonnie? Is he on?
Yes.
Good morning, board.
Good morning.
Good morning, Lonnie.
So on an annual basis, the CCP creates a plan and a budget for expenditure of AB 109 or 2011 realignment dollars. This year, because of all of the upheaval, we essentially mirrored the, what are we in? The 1920 budget for CCP, and it was submitted as a part of departmental budgets. So those funds that we would allocate in the CCP, that was included in probation's budget, in the sheriff's budget, et cetera. So normally it wouldn't be a thing. You've already approved the budgets for expenditure, and we would continue to roll on and conduct business and allocate those funds and utilize those funds. This year, as part of the governor's budget bill, there was a change made that requires us to submit to the Board of State and Community Corrections board approved plan, so Board of Supervisors approved plan, to draw down about $100,000 of that funding. So rather than try and go back and forth with the BSCC and explain that you approved our budget and our funding as part of the county's budget, I wanted to put this plan in front of you and be able to provide that document to the BSCC. For all intents and purposes, our goals and plans for this fiscal year and the expenditure of the funds that we have are essentially the same as the 1920 fiscal year. On probation side, there's been some minor programmatic changes. We've been doing a parenting program. We're going to stand up and have the probation officers facilitate some workbook-based cognitive behavioral programs. But outside of that, really business has continued as usual. We do face some challenges, as everybody does, with the COVID-19 response. And so I wanted to put this in front of you, answer any questions that there might be, address any issues that you've seen, or any curiosities that I might be able to fill in some gaps for you.
Any questions or comments to Lonnie from board members?
Just,
Yes, I have. Lonnie, can you hear me okay?
Yes.
Lonnie, tell us what you do, and I'm not sure what the surplus is, but how do you use rollover monies? Does it go back to the state or year to year, or do you share with your other partners? Tell us what that's about.
Right. So any fund balance that's left, it does not go back to the state. Those are county dollars when it's sent down. Our past practice since realignment has occurred has been that whatever funds remain unspent or we receive in excess of what we estimated, typically those are rolled over to cover jail expenses. So the sheriff, we allocate funding every year for housing for PRCS offenders, 1170H offenders, which is local prison commitments of various types, flash incarceration for those populations that we're supervising. And typically the sheriff has ended up with excess expenses that exceed the allocation that we've set aside at the beginning of the year. So once all is said and done, we have taken the fund balance and moved it over to the sheriff's allocation to help cover those expenditures.
All right, so Lonnie, the follow-up to that, since you are a multi-agency entity, is there any involvement which can assist the Crescent City Police Department? They're a member of your consortium, is that correct?
Yes, that is correct. The chief of police sits on the partnership and attends the meetings. It would be more than reasonable for them to ask for something of the partnership to cover expenses that are aligned with realignment, population, and goals. That hasn't come up to this point, but the chief is always involved in the discussions and sits in the meetings and has input to what happens.
I appreciate the clarification. Thank you, sir.
Mr. Chairman, if I may make a motion to approve the public safety realignment plan for fiscal year 2020 and 2021.
Second.
Somebody second? I got
I did. Second.
Okay. Motion by Howard, second by Gidlin. Any public comment, Kylie?
Chair, I'm not seeing any public comment at this time.
Okay. Any further discussion from board members? Kylie, please poll the vote.
Supervisor Berkowitz?
Yes.
Supervisor Cowan?
Yes.
Supervisor Gitlin?
Yes.
Supervisor Howard?
Yes.
Chair Hemmingson?
Yes, thank you. Supervisor Cowan, are you going to have to leave at noon?
I do. I've got to get somebody to a surgeon.
Okay, well, we better take care of that then. So I guess at this point, maybe we should adjourn if I can get a motion.
Point of order, Mr. Chairman. Are we not? Are we not?
You got a motion to adjourn. Can I get a second?
I'll second that.
I have a motion and a,
Mr. Chairman.
I have a motion and a second. Is there any discussion?
Yeah. Are you eliminating the final reports? You skipped over that in the beginning of the agenda.
I am, yes. So
I have nothing to report out.
Kylie, is there any public comment?
Chair, I'm not seeing any at this time.
Okay. Would you please poll the vote?
Supervisor Berkowitz?
Yes.
Supervisor Gitlin?
No.
Supervisor Cowan?
Yes.
Supervisor Howard?
Yes.
Chair Hemmingson?
Yes, and with that, we are adjourned. Thank you, Supervisor Cowan, for all your work. Appreciate everything you've done. Good luck in your future endeavors.
Thank you.
Next meeting is January 12th, 2021.